Good morning, everyone. Good morning, Queensland. Good morning to our Facebook Live followers as well. So in very good news today, it's a double donut day, so 0 cases. And in further good news, the 2 cases that reported yesterday that were under investigation have now been reclassified as not being cases, so we're very happy with that news as well. We have still 762 people who are still currently in home quarantine, and once again, thank you for doing the right thing. You're keeping Queenslanders safe. We have 37 active cases. We have had 12,760 tests in the past 24 hours. So that's once again really good news, and can I also thank Queenslanders for coming out and getting tested. If you have any symptoms whatsoever, please go and get a test. And yesterday, Queensland Health did 21,105 vaccines, which is excellent. So we now have 47% of Queenslanders have their first dose and 28.29% have their second dose. And I do encourage people to go and get vaccinated. Now today I want to talk a little bit about our hotel quarantine and the pressure that our hotel system is currently under. I had a thorough briefing yesterday from police and Dr Young and the Health Minister, and we are really concerned about the pressure that the hotel quarantine system is putting on our resources. So we have to change some of our policies, so there'll be a health directive that will be issued, and this is to sort this out as quickly as we possibly can. So as of yesterday, to give you an indication, we have 5,114 people currently in hotel quarantine. That's a lot of people. 3,257 are domestic arrivals. 1,857 are from overseas. These are all in 22 hotels. Between August the 9th and 20th, 2,750 people got border passes to relocate to Queensland. That includes 1,983 people in just 1 week. International arrivals are sometimes double, and we don't find out until the day. And we often don't know from day to day how many people are coming into Queensland from other states. They just turn up, they have their pass and they just turn up, and then they're just needing hotel quarantine. So that means that we are scrambling for hotels, and this has got to stop. It's too much pressure, so we have to put a pause. It's putting our workers at risk, and it's also putting our community at risk as well. So, starting from noon today, we are pausing arrivals into hotel quarantine for a period of 2 weeks. This is, of course, except for those people who are coming here that are exemptions, i.e. compassionate leave, or if they have medical procedures, any of those exemptions, of course, we will find hotels for them. These are people who are relocating from other states. So we simply just do not have any room at the moment. We are reassessing, we are looking at other options, but Queensland is being loved to death. So we're asking people to understand we're putting on this pause, and then what this will mean is that people will have to reapply for these border passes, and then you will have to book into a hotel. So we will have the hotels available, and you will have to have a booking into a hotel before you come and relocate to Queensland. We want to make this as smooth as possible, but I think you can appreciate at the moment not only are our hotels stretched, our staff are stretched, and this is becoming a risk scene for us, and we don't want to see Delta coming into our community. So we just need that 2 weeks pause, and then we will get the system up and running for people to do their bookings. And as I said, anyone who has those specific exemptions for bereavement, for medical procedures, of course, that will be treated as separate to this, this policy setting. Now, also too, can I also thank the Commonwealth? We've got the ADF coming today, so that's excellent. I'm advised 120 staff are coming along to assist with our borders, and that is, of course, excellent news. So I'll hand over to Dr Young and then the Health Minister and our Deputy Commissioner.
you, Premier. So excellent news, no new cases in Queensland overnight, and those 2 cases yesterday, those 2 truck drivers, we've done further tests on and confirmed they are not cases, which is really good. But despite that, I would like to thank those 2 individuals and all of our other truck drivers who work and cross the borders every single day. These 2 individuals had done everything correctly, so I think even if they had have been cases, it would have been very low risk because of what they've been doing. So thank you to them and thank you to all of our truck drivers. Now, the important thing going forward, of course, is vaccination. It is critical. We're getting more and more doses of vaccine available now, so anyone who hasn't booked yet to receive a vaccine, aged 16 through to 59, please do so. And anyone 60 years of age or older, please, if you haven't already been vaccinated, and over 80% have, but for those who haven't, it's critical that you see your GP and get vaccinated. If your GP is one of those very, very few GPs that can't provide the vaccine, they can assist you where to go and get vaccinated. That's critical. Thank you.
So I want to thank all of our staff who are working in our hotel quarantine, to the Queensland Police Service and the health workers. They've had to stand up a number of hotels very quickly to deal with these surges that we've seen as Victoria, ACT and New South Wales cases grow. And again, I just comment that the most recent data out of New South Wales, their cluster has grown to 13,765. On top of that, Victoria's 522 and the ACT 167. So when you look at the increasing number of cases involving those clusters, all originating out of New South Wales, we are seeing a lot of people wanting to relocate to Queensland. We understand that. It's a beautiful state. Why wouldn't you want to live here? But we just need a pause on that. About 85% of the people who have come under right of entry passes over the last 2 weeks of domestic travel are simply relocating to Queensland. So we do need to put this pause in place. What it means is anyone who's not already on a flight at midday will not be able to arrive simply on a right of entry pass. Everybody who's got a right of entry pass, who's a Queensland resident or is seeking to relocate, will need to reapply for their pass, and over the next fortnight we will then issue passes, but we will be allocating a time period that people will be able to arrive in Queensland. This will help us manage room capacity much better by knowing how many people are arriving and when, so we can make sure there's a room allocated to them. What this will also allow is over the next fortnight, it will ease capacity so that those who have exemptions already approved and apply for exemptions for compassionate reasons, end-of-life visits, attending funerals, that they're going to have rooms available for them. So it's really important that we've made sure we can provide for those people over the next fortnight. We'll have more information online as to how people will be able to apply for these passes and process going forward. Fantastic vaccination numbers, our highest rate of vaccination per day that we saw yesterday, 21,105. So thank you to everyone coming out and getting vaccinated. We want to see those numbers continue to grow. We want more people coming out and getting vaccinated, not just here in South East Queensland, but in our regions as well. As I said yesterday, we don't want to hit that 80% target just in South East Queensland. We want 80% of our population fully vaccinated and higher, as the Premier said. Let's go for the same rate as we do with child immunisation, 95%. Let's see everyone getting vaccinated, but we want everyone, everywhere in Queensland, fully vaccinated as quickly as possible. So come forward, register with Queensland Health to get vaccinated. Alternatively, book in with your GP or either walk in or book in with your community pharmacy. You can find all of those local vaccination hubs on the Queensland COVID website. So please jump online today. Don't wait. It is about keeping you safe. It's about keeping your loved ones and the community safe and helping Queensland open up quicker. Thank you.
Good morning. Overnight, on our road borders, we processed 5,397 vehicles, made up of 3,296 cars and 2,101 heavy vehicles. Unfortunately, we had to turn away 211 of those vehicles and heavy vehicles. And could I just ask today that people please make yourself familiar with the passes that are required and the entry requirements to Queensland. It will make it a much better experience at the road border when you come through if you have all the correct paperwork. On our air borders yesterday, we processed 529 persons and put 294 of those persons into our hotel quarantine, putting further pressure on our system. Yesterday we handed out 24 masks to the community, so can I thank the community for their ongoing compliance with the masks and their ongoing engagement with police. We were not required to give out any penalty infringement notices for masks. However, we did issue 5 penalty infringement notices for people doing the wrong thing entering our borders into the state. Just in relation to other compliance, we did visit 36 businesses yesterday and all were found to be compliant. So again, thank you to our businesses for continuing to work with police when they do come around for our compliance checks. As the Premier said, we do get 120 additional ADF on the border today, and that's to boost the original figures that we've got of 84 ADF already supporting us in our hotel quarantine with the 525 police that we've got deployed right across COVID doing those functions. So we welcome the QPS to have more of our ADF colleagues on the border with us today. They've been there with us before and we welcome them back and look forward to working with them. So thank you.
Thanks, Deputy Commissioner. Happy to answer any questions.
How did you come up with a 2-week time frame and how do you know that will be long enough to pressure on the system?
Well, the 2 weeks will definitely ease the pressure, but also to, look, we're helping the Commonwealth out at the moment too in terms of the relocation of people from Afghanistan. So we're getting calls about needing extra capacity to cope with that. So we're just being stretched. We're just being stretched to the limit. So this 2 weeks will ease it all down and then people will have to book, reapply for their pass and book. But, you know, we also want to make sure that the system is running smoothly. So we believe that by putting these measures in place, this was put to me by Police and Health. They came to me with this proposal and we went through it in detail and I've accepted it because it impacts on their resources, all the work that they have to do. Managing quarantine is a big job and to have over 5,700 people in quarantine is extremely large. It's the largest we've been at.
Is it a bit rough on those Queenslanders though interstate trying to get home?
Look, they'll still be able to come home. We're just having this pause for 2 weeks and then they just have to book the hotels and they'll still be able to come home. I want them to come home. If people want to relocate here, I want them to relocate here, but we just got to do it in a sensible and orderly fashion.
When do you anticipate that people can start reapplying?
Sorry?
When do you anticipate people to start reapplying for their passes? Will it be in 2 weeks' time or in the next couple of days?
Probably in the next couple of days. We'll get the system all set up, but we've had to act very quickly because, as you can see, the capacity has breached its limit.
Premier, you said you're scrambling for hotels. What about home quarantine? Is that something you'll seriously consider looking at to roll that out?
Not at the moment. No, we're not looking at it at the moment, no.
Why is that?
Sorry?
Why is that?
I think from memory there was a trial happening in another state and they were going to report back.
But isn't that something you could now seriously look at? There's technology where you can have sort of like tracking apps and things like that. Why not for Queensland?
Well, I think there was going to be a report to National Cabinet from a particular state that was looking at it, so we'll have a look at that. Yeah.
The data shows that per capita Queensland's still one of the slowest vaccine rollouts in the country.
Give us more supply and we'll put it into people's arms. If the federal government wants to give me 100,000 more Pfizers, I'll put them into people's arms.
A lot of AstraZeneca supply around, and
people can go to their people can go to their GPs and their pharmacists and get AstraZeneca today.
What about at mass vaccination hubs as they're doing in other states?
Well, they've got big virus outbreak at the moment. Ours is working very well. As you've seen, we're actually taking ours out to the workers that need it as well, into those hubs that we talked about this week. We're taking it out to the regions and I'm happy with those vaccination rates, but if you give me more supply, we'll put them into people's
You've
arms.
said yourself that you're worried about the vaccine coming into Queensland from other states and that we could any day now have another outbreak here. Shouldn't we be preempting that by possibly giving first dose of vaccination?
We have people there. People can go and get their Pfizers from our vaccination hubs. They can go and get their AstraZeneca or Pfizer from the GPs that are registered with the Commonwealth, and they can also go and get the AstraZeneca from the pharmacies. And I understand Moderna is coming as well, so they'll have that additional resource. So I'm looking forward to hearing about our allocation of Moderna, because I'd really love to get that Moderna out to people as quickly as possible as well. And the Deputy Commissioner briefed me yesterday, 269,000 vaccines last week. 269,000 vaccines last week, Commonwealth and state together. That's great in Queensland.
Other states have these similar supply issues when it comes to Pfizer. Why is it though that Queensland
No, they've been given
per
more.
capita rate is slower? That others, not all other states.
Oh, well, I think that's incorrect.
But it is correct.
Yes, Tim.
Can you confirm to us when you received the Griffin report?
Sorry, I haven't received it yet. But
When
it's
the
gone to the
government
health.
received it?
It's gone to the health minister, and then it will be coming into cabinet, and then it'll be publicly released. So I expect it'll be coming into cabinet next week. Yeah.
Why
So it'll be
hasn't it been
Monday.
released now? I mean, surely it's a matter of
No,
urgency.
it'll come to cabinet. The health minister will have a look at it. We'll go to cabinet. It'll be publicly released next Monday.
But given the outbreaks that we've had this year have largely been leased out of hospitals or hotel quarantine, surely the matter of urgency...
Sorry, is
won't go
everyone
this
having a
year.
look what's happening in New South Wales at the moment? How many outbreaks they have had? Hospitals going into emergency with Delta through their hospitals. I don't see all the reports on those hospitals at the moment. We will release our report next Monday, and perhaps you might want to ask where are all the reports that are happening in New South Wales with all of the outbreaks there at the moment.
No, that's great.
Yeah.
New South Wales, I'm worried
Yeah,
about Queensland hospitals.
Yep.
But
Yep. Well, it's going to the health minister. Come to cabinet on Monday. That's a pretty quick turnaround for a cabinet.
Sorry to clarify, you'll get it on Monday to cabinet and then you'll release it
Yes.
on Monday as well?
Yes.
Okay. Can Queenslanders expect to be placed into lockdown with 1 or 2 cases of Delta going forward?
In what respect?
If Queensland records 1 or 2 cases of Delta, like community transmission?
Well, it depends. It depends on where it is. Like when we had those freight workers yesterday that we suspected they could have the Delta, they had very limited contact with anybody. Then we had the outbreak, the Indooroopilly cluster, remember, where the high school student had it? And then we thought, well, this is of concern because it would have gone through the high school, probably taken home to the parents, and we had that big cluster. So it depends on the circumstances. So I'll be listening to Dr. Young.
Are we just on home quarantine?
Yes.
Didn't the Indooroopilly cluster show us that home quarantine works, though?
Sorry?
Didn't the Indooroopilly cluster show us that home quarantine essentially works? So couldn't we adopt that model for Queenslanders wanting to come home?
Look, it's quite complicated. Look, we're looking at all options at the moment. Let's just focus on this today in terms of the hotel quarantine. But also too, that also shows that if you have a household, the whole household has to isolate as well. So we have to work through those issues.
But on that, doesn't it prove that Queenslanders can be trusted to do the quarantine at home so they can come home?
We're working through those issues.
Question for the show.
Yeah.
Industry leaders down in those border communities on the tweet have been told that you're working off a 10-week basis minimum for things to get back to normal down there, and that is off that 70% vaccination rate. Realistically, is that achievable? Could it be achievable before then? And is that just that southeast Queensland area or all of the state?
There were a lot of questions there. So I would think if we continue our current vaccination rate and we continue to get the supply we need from the Commonwealth, then I think over the next 10 weeks we should be able to see 70% of people vaccinated. But there are an awful lot of ifs in that. The most important if is that people need to come forward and get vaccinated. So we've seen the enthusiastic people, if I could put it like that, early on, come forward, register, and every single booking's taken up, which is fantastic. I now need to get the people who are not quite as enthusiastic to come forward. So it just depends if people come forward. And then it also depends what happens in New South Wales. If they get this outbreak under control in the next few weeks, that will mean things will happen much earlier. If they can't get it under control and it takes longer, and they don't have the vaccination numbers, then it could be longer. So there's an awful lot of hypotheticals there.
Dr. Young, infectious diseases experts, some of them are contributing the government's messaging around AstraZeneca to the hesitancy in Queensland and a slower vaccine rollout in the state. Do you accept that?
At this point in time, the national advice that I've always followed from ATAGI, who are the experts in this area, has been that people 60 years and over should be getting AstraZeneca. That hasn't changed. There was a bit of confusion for a while about 50 to 60-year-old, because I'm in that group, and I went and got AstraZeneca because at that time that was the message. That's since changed, so it's only now 60 and older. Those 16 to 59-year-old should preferentially access Pfizer. But if they choose to, particularly in an outbreak, and we're not in that situation at the moment in Queensland, but they can still choose to, go and see their GP and talk to their GP about accessing AstraZeneca if they wish to, and they have to have that discussion. Then we've got another group, 12 to 15-year-olds and First Nations kids, are 12 to 15-year-olds who are particularly vulnerable with underlying health conditions, and 12 to 15-year-old kids who live in regional or rural Queensland can get vaccinated with Pfizer. They can't have AstraZeneca.
Dr. Young, just on hotel quarantine, how much of a health risk is that becoming given the pressures on the system at the moment?
Well, it's not a health risk at the moment because we have got fantastic police and health working together, but it was becoming unsustainable. The numbers of hotels that were being brought online with very, very little notice, we just couldn't continue that. We just can't go and stand up more hotels every day as we were doing, because there are risks for the individuals, for the staff who work there. They need to be vaccinated, they need to be trained in using PPE, they need to be trained in infection control, and we've just reached that capacity. That's why we just need a pause to recalibrate.
Dr. Young, there was a woman, Tony, interviewed on radio this morning who says she's unable to have a life-saving heart surgery in Queensland because her doctor, who's one of her surgeons who was in Sydney, who is one of the few people who knows how to operate a specialised robot, is unable to get an exemption to come into Queensland. Can you confirm what has happened with that case?
I don't know about that case, but I can assure you that no one in Queensland is denied any urgent treatment because of a quarantine issue or a requirement. So during our Indooroopilly cluster, we had 400 of our most senior health staff who were at home, and I actually had to give an exemption one night for a cardiac surgeon who was in quarantine to go and operate on a baby. And so the family understood that there was a risk there with this surgeon coming. They agreed to that risk. The operating theatre staff, everyone agreed, and it went ahead. We will always make arrangements that need to be made.
So that surgeon would be able to... You would
Depends.
be able to give an exemption.
Well, it depends what the issue is, where this woman lives, whether there's someone else in Queensland. There was no one else in Queensland who could do that particular operation. So without knowing the operation, we actually have a lot of cardiac surgeons in Queensland. We just don't have many paediatric cardiac surgeons who could do that particular procedure. Whereas if this is an adult, I would suspect we'd have a lot of other surgeons who could do the procedure. But we'd work that through. So if someone could send me those details, I'll get someone to look at them urgently, of course.
Premier, just wanting to see if there's been any movement on Queensland hosting the NRL Grand Final.
No updates yet, but fingers crossed. Yep.
Health Minister, can we just ask you, if you've seen the Griffin report, can you confirm what your initial recommendations might be to Cabinet?
Well, I wouldn't be talking about something I'd be reporting to Cabinet. I've received a summary overnight, but I'm actually getting a briefing today of the full report, and then I'll be preparing a report for Cabinet.
Will you be reading the report in its whole or just the briefing?
Of course I'd read the report in the whole.
Will you release the report in whole?
Oh, I've got to see the report. I have said previously I'll need to see if there is any identifying individuals and whether names need to be removed, those sorts of things. But we're committed to releasing the report, and we will. It's really important that we make sure that we look at the recommendations and any findings and any learnings that we get. I will say this though, Yes, we have had a small number of transmission, and I will say a very small number of transmission in our hospitals. And in the case we're talking about here, one person got affected off that health worker. One person. It didn't lead to a massive cluster, an outbreak. That doesn't mean it couldn't have, and we need to learn from this. But we do need to put it into perspective that our health workers do an incredible job, and they're dealing with an invisible, deadly virus that no matter how well we do, there is going to be times that there is going to be a risk and there is transmission. And we will continue to look at ways to improve our systems in our hospital, because I don't want to see what's happening in New South Wales, where 1 in 5 people who have died from the current cluster in New South Wales has caught it from a hospital. I don't want to see that. So we'll do everything possible to make sure we've got the best practices in our hospitals.
Has the missing link been any development with the missing link from the latest outbreak?
No, I don't believe so, no.
The government's given people a 2-hour warning about this boards in hotel quarantine. Is that good enough, and should it have been foreseen earlier?
We have to do this, otherwise a whole lot of people will be racing to the airport to jump on planes. And what we'd have is an even greater problem, because we'd have even greater surges than what we have seen over the last couple of weeks. So we can't afford to put our system under even more pressure by having such a large window that would actually create this perverse incentive of people coming to Queensland quicker.
Premier, on the hotel quarantine for international arrivals, are you looking at a cap for those people, or?
The international arrivals, we already have a cap. It's a 50% reduction that was put in place with the Prime Minister. But what we have seen there is actually surges above that cap, like a lot of surges. So that is concerning as well, and we've been accepting those international arrivals. Yeah.
And towns like Mundai, a lot of frustrated locals there at the moment. You've got the hospital on one side of the border, a supermarket as well. Are there extra support services being put into those towns, like people who can't drive, say, 100 kilometres to go to the supermarket?
I'll have a look at that. I'm not aware of those issues. They haven't been raised with me before, but I'll have a look for you.
Any room for maybe a border bubble? That's quite a unique
look, we've
situation on the border.
I'll have to have a look at that town. Look, but as you can see, we've tried the border bubble issue with the New South Wales Premier, and the answer has been a flat NO. Yeah. Okay, thank you. Thanks. Have a nice day, everyone.